Hello, and welcome to week 5 of the TAMUC Survival Guide COVID-19 edition 5-week program. My name is Ciedra Munson, and I will be your moderator for today. I am joined by my group members, Bill, Quincy, Micah, Shania, and Ebony. Each week, we will have facilitated a session focused on COVID-19 topics that are relevant to the campus community. This program is hosted by TAMUC public health students enrolled in program implementation and evaluation class taught in the Health and Human Performance Department. Last week, we talked about various COVID-19 myths with a discussion on how we can play a role to share accurate and useful information. Today, as COVID cases continue, we know these conversations and efforts to fight this pandemic are needed. Today, our guest speakers will help us wrap up our program with a conversation on what the future looks like in this new norm of working, schooling, and living. Most importantly, what we can do individually and collectively to limit the COVID-19 spread. To get the session started, I will let Bill introduce our panelists.
Thank you, Ciedra. I will be introducing our two guest speakers today. Today we have Jennifer Rainey. She is a public information officer at Denton County Public Health. Ms. Rainey is an advanced public information officer at Denton County Public Health in Denton, Texas. She is committed to government accessibility and clarity via plain language and strong dedication to the communities she serves. Currently, Jennifer's role is a constant response to COVID-19 while juggling multiple other media and community members' requests, views, and both internal and external communication. Jennifer implements communication best practices from crisis and risk communication training and regularly demonstrates leadership, effective communication, and delegation through COVID-19 responses. She consistently works alongside team across DCPH, Denton County Public Health, to maintain exceptional, transparent, and reliable communication. And our other speaker is Michael Stark. He is the Director of Residential Living Learning here at Texas A&M University of Commerce. Michael has served as Director of Residential Living and Learning at TAMUC for the past years. Over the past 21 years, Michael has worked in student affairs at public and private and rigorously affiliated colleges and universities in the Midwest and South. Michael's professional areas of expertise and interests include campus housing, campus safety and security, community development, student learning, and crisis management. Back to you, Ciedra.
Thank you, Bill. To help kick off our discussion today, Ebony will get into an icebreaker. Ebony, could you please start the icebreaker? You have about 3 to 5 minutes.
Thanks, Ciedra. So once again, I'm Ebony. Today for our icebreaker, we're going to ask, what emoji would you use to describe getting a vaccine? I'll have Jennifer go first, then Michael, and then I'll have Bill go. Our viewers can also post the comments or post the emojis in the comments.
Oh my goodness, I get so nervous with needles. I'm a type 1 diabetic, and I feel like it's a mean prank that I'm totally scared by needles. So I would probably use a little shocked face with the little hands around. But then also the cool face, because vaccines do help prevent a lot of infections and diseases and illnesses. And I think that's really cool from a public health standpoint, that we have the power to slow the spread and to slow diseases that otherwise we couldn't.
I agree. Michael?
I feel like I'm the whelp. There's a lot of positives to it, and also I don't like needles, and I've never had the flu, And I know we'll talk some about the flu, but even the idea of getting a flu shot and the flu vaccine is kind of a, yeah, I don't know. So that's me.
I can agree with that. I think everyone feels like they hate needles and they don't want to get the vaccine, but it is helpful. So I'll send it back to Cece for her to continue.
All right. Bill, could you tell me what emoji would you use to describe vaccines?
I actually was never really afraid of needles growing up, so I'm a little bit different. But I would probably do kind of the cool face too, because vaccination is cool, and just I guess a relief face because I got that over with, and then I don't have to worry about getting another flu shot later into another year. So, yeah.
That's interesting. Most people do not like needles. Thank you, Bill and Ebony. I will now start the panel discussion, and I'll begin with Michael. How has RLL adjusted in living arrangements or policies in this pandemic to adhere to the health regulations and working to maintain a safe living environment?
Yeah, it's a good question. So, I think in general terms, we've taken a two-prong approach. It's about trying to manage the physical environment and also trying to address student behavior, right? So from a physical environment standpoint, as we think about social distancing, the wearing of masks, for those of you who live on campus, we did a very different move-in process. It was a centralized process over in the parking lot by Halliday. Folks drove up. We had people meet them at the vehicle while wearing masks, did all of our check-in process there, limited the number of students and guests who could come to the building at any one time, limited the amount of time at the hall. Because if you've lived in Whitley, the elevator is really small and it will back up at some point during move-in. So we really adjusted that part of the process because that is about the physical environment. We removed really the opportunity for guests from other halls at this time, trying to keep communities ideally socially healthy, or not socially healthy, but physically healthy, because we are trying to limit the number of other individuals coming into a space, which could change your likelihood to have an interaction with a COVID positive individual. Where possible, we looked at reducing density in buildings, particularly buildings that have community bathrooms. But that, unfortunately, right, community bathrooms not a thing that you can actually change. Like those are a thing. We engaged with custodial and maintenance. The university has a third-party contract for additional cleaning in all of our spaces and common kitchens. So I think those are a couple of the examples that I would use of a physical approach, or an approach to the physical environment that is different than what would be done as right in terms of the normal process. The other end is looking at what does education look like around the information provided, that we help support the training that was required of all students to return to campus, right? Washing your hands, wearing a mask, the importance of that, wanting our staff to have those conversations, and smaller programmatic elements that we do in the halls. So trying to keep some of the familiar, but also do it in a different way. There's a lot of learning and repetition that's involved in changing of habits. So we end up doing a lot of that in various ways, both large scale and small scale. And in the end, hoping that we're educating a community who then educates each other, right?
Yes, I know changing habits can be difficult. For you, Ms. Jennifer, for you working at the community level, I know that there are laws in place on vaccination requirements. Can you talk briefly about why vaccinations are important?
Absolutely. Vaccines are all about prevention. Before we had vaccines, people got very sick and often died from, or they suffered greatly, with lifelong health issues. Now we know that we can prevent some of these diseases safely with vaccination. Sometimes people believe that they can ward off all diseases with healthy eating and exercise habits. those are all really important things, and we definitely know that those have a great impact on your life, your heart, and your overall health. But that's not the case for some diseases. You can't ward off measles with healthy eating or exercise. We also know that when we stop vaccinating, that some of those diseases can come back. We've seen that with pertussis and with measles most recently. It's crucial that we continue to vaccinate so that those diseases don't pop up over and over again. Vaccination is one of the many things that we can do to keep yourself and to keep your family protected from serious illnesses.
I like how you mentioned that people think healthy eating can prevent them from becoming sick or having diseases, but like you said, that's not always the case.
Right. It's good for you. It's absolutely good for you. And public health will always recommend eating, your vegetables and your fruits and things like that. But it just can't get rid of COVID-19, and it can't protect you from measles, things like that are infectious and concerns.
Right. For our audience, if you have any questions, please drop them in the chat and we will answer them later. Michael, in your role, you get to interact with students and staff here on campus. What are some major concerns you hear or see regarding this COVID-19 pandemic?
When is it going to be over? Is probably number one, both from faculty, staff, and students. I think for many of our students, what I hear, and I hear from our staff too, is, one of the challenges, I expected the year to still be different. Like, I knew coming in that COVID was a thing, and yet I didn't have any experience with it. And what I thought maybe was going to happen on campus still hasn't actually happened. Like the guest policy in terms of housing. Nope, you may have also expected to be able to hang out with people in their room in a different building, but from our perspective and a safety measure, that would be a no. But that's a big thing. Like, okay, well, I can't do that. Well, also, where else in commerce can I go 24 that's open at midnight to hang out, right? So events we know are very small that are happening. There is no athletics that are, open to anybody attending a sporting event. So I think there were some hopes and dreams for what hopefully fall was going to be that didn't quite pan out yet is the goal. So dealing with the difference in expectations. Seeing COVID numbers going up across the country and what's reported, right, brings on some stress of, okay, so these are all going up. What does that mean for me in staying healthy? What does that mean for my family in staying healthy? Because it isn't isolated to Commerce, Hunt County, Texas. It is everywhere. I've heard a few, like, I already expected there to be a vaccine. Was a hope that's come through. We see some of that in contract release requests. Other students are not following the rules, so worry about what other students are doing to influence their community. And then there was also kind of fear of their work creating a potential health issue. So some campus jobs students are not maybe real thrilled about, or even off-campus jobs where I have to go and interact with a bunch of people. What is that? I don't want to do that because I don't feel like I'm being safe, but yet I need the money as well. So there's a balance of that financial piece. I know what I need, and also I'm not real comfortable, right? How do I balance some of those things? My interactions are definitely on a different level as a director. I'm not as boots on the ground as some of my folks are. And I would say that, some of what I report is what I hear from them. Some of it is from other conversations. And I'm certain that there are things that I'm not representing that students have some similar kind of concerns. The other is, I'd say things that I see, behaviors where we try to hold on to what we thought was familiar or what we want it to be. So going to parties, going out to restaurants consistently, as if I go to this restaurant and nobody's wearing a mask and I'm not likely to get sick because I'm in a restaurant. I don't know. I think those are two very real kind of issues. And also, right, decisions being made that are not necessarily based on data, or even like CDC guidance, like, oh, well, if I do, it's kind of, I think, to Jennifer's point, like if I eat healthy and exercise, I'm going to be good, or I'm young and I'm invincible, I'm not going to get COVID, or if I do, it won't be bad. Like those are definitely things heard and seen, and that is not student directed. That is also faculty and staff. We want things to be the way they were, and folks are running out of energy and patience, and because that takes a lot of mental fortitude to kind of persevere through really what is a pandemic, right? And is a crisis.
Yes, I think we all envision this semester being totally different. And I often hear, oh, I can't wait until 2020 is over, as if 2021, we're not going to have COVID. Now, switching back to vaccines, Jennifer, there are a lot of debates about the safety and effectiveness of vaccines in general. What would you say to that, especially now that we are going into the flu season?
Oh, I think going into flu season, this is where the debate always comes out. As somebody who's worked in public health for a couple of years, there is always a debate about the flu vaccine and its coverage and its how effective it is. With COVID-19 and with the flu season combined, that's something that we were nervous about. Gosh, probably in June, we started having concerns and questions around that. We know going into flu season, the number one thing you can do to help slow your risk or lower your risk is to get a flu vaccine. It's recommended for everyone 6 months and older. And if the benefits didn't outweigh the risk, that just wouldn't be the case. They wouldn't recommend someone vaccinate their child. We wouldn't recommend having elderly individuals getting higher doses. This is just evidence. There's evidence-based decisions, like Elizabeth mentioned. There are evidence-based decisions that lead public health, that lead the CDC, that lead all of these organizations. I think it's important also when we're talking about vaccines to understand that vaccines go through rigorous testing during 3 phases of clinical trials, and they're also monitored continuously even after they're licensed and available for the public. So not only is there a lot of trials and a lot of rigorous investigation and testing going on beforehand, but even afterwards, there's the vaccine adverse event reporting system where individuals, including parents, including patients, and also healthcare providers can report on any adverse events. There's vaccine safety data link, and then there's also CDC's clinical immunization safety assessment project. And so those are a network of vaccine safety experts that monitor vaccines. So I know that it can be worrisome, especially when people wonder if they're going to have some type of reaction. But a majority of those reactions are very, very mild. Those are things like soreness or redness at the injection site. So it might be a bruise afterwards. And those are things that are reported as an adverse reaction. And those are side effects, not necessarily a sign of a severe allergic reaction.
Thank you, Jennifer. Michael, as we wait for a COVID-19 vaccine, the push right now is to encourage everyone to get vaccinated for the flu. What are some good strategies we can implement to make this push for our TAMUC campus?
That's a good question. My experience is that behavior doesn't change until there's a reason to change it. And that individual has to believe in that reason. So, the best advertising is one that makes an emotional connection with folks, right? So I'll give you an example. There was a campaign to reduce the amount of soft drinks drank, right? And this campaign used visual images that are shocking, and they saw, and so for example, instead of a person drinking like a 2 liter of soda, it's a 2 liter of fat actually coming out. And they worked with these visuals to help folks not just hear, oh, I should drink less soda because it's got then I'm not getting all this sugar and I won't feel badly. No, actually that's disgusting. I am drinking fat. Okay, I'm gonna be cutting this down. And they saw a marked reduction in soda consumption. I think the same is true related to how we try to tackle anyone getting a flu vaccine. How do you make it personal, but how do you make it humanistic, right, in a way that I see the benefit for me, my community, my family, that I want to make the change. Not because, the health department says I need to do it. Like, nobody does anything. Very few people do anything because the health department told them to actually do it. Oh, I internalize it and I believe that this is a good thing. So I think our marketing around getting a vaccine makes a lot of sense for the institution to look at. How do we target micro groups, right? How do you go after small pockets that can then make the change and the shift? If I think about a bell curve, the folks always on the really risky end, if I get them to move one step, they're still in the risky end. If I get the people in the slightly risky end to make one step, they're in the better place, right? Like that also being a place of who do we need to target that group. We want the other group to move, but realistically, we spend more time and energy not getting much to change than if we focus on, I think about micro groups, like how do you really work with pockets? So the idea of involving advisors with student organization presidents and those groups, that may be a great strategy to get, a group of individuals to go get the vaccine. I think even the university to a point of saying, hey, we are going to we've scheduled this time for Whitley Hall to get the flu vaccine. We're doing it this time. It is an option. We don't have to explicitly tell you it's an option nor that it's a requirement, but most people are going to do it then as well, because that's, oh yeah, okay, so we're gonna go do this. And I'm going with other people. I don't have to go by myself. I don't know anybody at CVS. I don't like needles. Strength in numbers is important. So I think there are different ways to do it, but just putting out a flyer, at least to me, isn't going to be the way that folks get the flu vaccine. I think folks would be more inclined to do that for COVID based on it's a pandemic, but not in our lifetime has the flu been billed as a pandemic and a reason to shut down a university and put people into quarantine and isolation. So I think of them as really kind of two different things. I don't know that we want to say the flu is a pandemic per se, but finding ways to make those connections, I guess, on the topic.
I like how you mentioned that when you have someone to go with you, like an accountability partner,
Yes.
it makes it easier because, like you said, you're not by yourself. Miss Jennifer, given the COVID-19 pandemic and the work towards getting a vaccine approved, there are concerns about if it will be safe. How can we assure the public that care is being taken and that this is an important aspect of maintaining the pandemic? Also, when do you think we will have a COVID-19 vaccine?
That is a loaded question. I think concerns are understandable and we have to approach everyone with empathy. That's one of the biggest parts of my job and something that I think all communicators, all public health practitioners are juggling both of those, the concerns and the empathy, but then also the science. Ultimately, we all want what's best for our community. We want what's best for our grandparents. We want what's best for our fellow classmates. We want to get back to normal or to whatever normal will be in the future. And in public health, we have to continue speaking up for prevention. We also have to remain transparent with what we know and what we don't know right now about the COVID vaccination, about treatments. One thing is to remember, and that's really important with the vaccine discussion, is no matter how quickly the vaccines are being developed, systems and processes have been in place, are already in place that ensure effectiveness and they ensure safe medications and vaccines are making it to the market. So the FDA originally, kind of a brief overview of those processes is the FDA approves medicines and vaccines for licensure once their team of scientists determines that they are safe and that they are effective. Vaccines then go to a different board, the Advisory Committee on Immunization Practices, and that group analyzes the data to make sure that it's also safe and then makes recommendations on the use of the vaccines. So who should get them, which group should be a priority, should children get them, should elderly individuals get them. And those members of ACIP, the Advisory Committee on Immunization Practices, those members are experts in infectious disease, in virology, in immunology, in pediatrics, and family medicine, in internal medicine, preventive medicine. It goes on and on and on and on. So these are experts. They are the top dogs. They have so much knowledge and so much education. And what we know currently about ACIP is that they normally meet 3 times a year, and work groups meet more frequently. Right now, though, the COVID vaccine work group has been meeting weekly, and the entire ACIP is meeting monthly. So we know that they're reviewing data and having these discussions much more frequently than usual. They're trying to go as fast as possible. From a timeline standpoint, when you said, when do you think we will have a COVID vaccine? I wish I had a crystal ball. I so wish I had a crystal ball. From what we've learned so far, vaccine rollout should roll out in phases, and those that are at the highest risk for COVID infection would be prioritized to receive it first. From what ACIP has said, it'll most likely be that the recommendation would be healthcare professionals and first responders first, and then moving to the elderly adults, those living in long-term care facilities, and those with high-risk medical conditions. So like I said, we don't have a crystal ball, but we do know that our state and federal partners are asking us to be prepared for phase 1 to begin within the next few months. So we're rapidly making those changes, making as many shifts as we can, getting those very, very ultra cold freezers ready so that we can be ready as soon as it does come to market. What we also know right now is there are 6 vaccines that are in the later stage of clinical trials right now, and 5 of the 6 of those currently require 2 doses. So that's spread apart between 21, 28 days where individuals will have to go back. And so that'll be, like Michael said, it's going to be another messaging challenge. It's going to be something that we're really going to need to stay on top of as a community so that we can make sure that immunity is higher if you get both of those. And really ensuring that our community members know that there would be two vaccines. Knowing all of that is something we're all learning together as a community. It's not just all of us secretly withholding this information. We're learning it at the same time as everybody else, as we're seeing those same press releases that everyone else is seeing, like we just saw, what was that, a few days ago with the Pfizer press release on their first round and stage of trials.
Thank you. That was great information. I know our audience have some questions that they would like to ask, so I will now invite Ebony back to drive that Q&A session.
Thank you, CC. Our first question is going to be for Michael. What are the unintended consequences of self-isolation that is required to keep safe from COVID-19?
Yeah, I think there's a couple, or in particular. So, you know, on the individual person end who has to either self-isolate or even self-quarantine, it is coming to terms with the idea of being in this space wherever it is and not leaving. Like, I think generally we like the idea of, oh, I could stay home all weekend and it would be fine. Well, when it goes on to being 10 days, when it goes on to being 14 days, that's a different matter, right? If you are following the protocol and not leaving that space. In particular, if you live in an apartment off campus or even any space on campus, you're generally talking about a much smaller space. You're reliant on people to bring you food and some other necessities that may be needed. And I'm in this little box. And so that loneliness piece can really set in, the frustration of I can't go out, I'm trying to keep up with classes. So at least in some of the conversations with our colleagues in the counseling center, it seems to be an elevated stress level, right? So it's not just as simple as, great, we're gonna isolate you 10 days, it'll be fine. Hopefully you don't end up with symptoms that are really severe, obviously, but 10 days and then you'll be out and everything will be fine. But those 10 days actually have can take a lot of emotional strain on the student and even potentially the family as well. So I think that is one piece. Over time, the process of isolating and quarantining individuals also there's another group of people who work on that end, and that gets to be exhausting at times because those hours are different. They're extra work on top of everything else they're already asked to work. There's always the potential for close contact. So every time I interact with a student who needs to go into isolation, I'm potentially exposing myself to COVID, right? As an example. So I think there is even that end of not the people going in, but the people who are trying to be helpful and work a process. I know our counseling center has developed, so I just feel like tooting their horn for a minute, but they had developed moments of reflection. I'm trying to remember what the name of their program was, but really an envelope. It's reflection for each day that you're in isolation or quarantine. So helping students have some mindfulness while they're in place. But there is that. I think it's, again, easy to think about the physical stuff that goes into it and what we need to provide people, but then there's the emotional challenges that are really hard to predict how any one person is going to react to that, right? We never really know what. So there was a little thing that popped up on Facebook with two dogs in mud. One's a big dog, one's a little dog. How is the mud? How deep's the mud depends on the dog, right? A little small dog definitely covered more in mud. And I think that is true of each student has a different kind of reaction to that and how they kind of cope with being in isolation or quarantine, which in many ways are the same thing.
I agree. And our health center and counseling center does a great job at assisting the students and the staff. Jennifer, your question is, I know you're a health professional and you've already explained how important it is to get vaccines. Do you believe that everyone should get a vaccine for immunity?
Goodness, absolutely. I think we've all sat through 2020 long enough to feel completely overwhelmed with, just like Michael was sharing, with staying home and staying out of the loop. I think as long as your medical provider doesn't say there's a reason not to, if you have some type of condition it might not be safe. But if your medical provider thinks that it's safe for you to get vaccinated, then absolutely. I think we owe that to ourselves. We owe that to our fellow students and classmates. We owe that to our grandparents, to our neighbors, and to those high-risk individuals to do as much as we possibly can, whether it's wearing a mask or getting a vaccine, to protect ourselves and to protect each other.
I definitely agree. Okay, Michael, your next question is, if students have not gotten the vaccine for the flu, do you think they will get it now? Why or why not?
Well, I think I'd go back to my earlier statement. Until somebody feels that it is important to them and to their family and their community, they're not going to do it. I hope so. I hope they're thinking along the lines of, yep, this is good in light of COVID. So if I stay healthier, I'm less likely to be impacted maybe as negatively by COVID as I could be. Unfortunately, I don't have any sense of how many students are actually taking advantage of flu shots. I haven't seen any data yet to say, yep, we're seeing higher numbers or not. I hope so. I really want that to be the case. I'm a little more pessimistic about, again, folks deciding individually to go do something until they really internalize it and feel like that's an important thing for them, because they've had opportunities for many years to get a flu shot, and if they never have, why are they starting, right? What's the messaging around that? I think there are some positives. I do think, though, that social media is not necessarily helpful, because there have been a couple of comments about symptoms like mild side effects, or I have an adverse reaction. That is what I see get posted from people I know on Facebook. Got my flu shot, was sick for 2 weeks. Nobody posted got my flu shot and it's great and it's rainbows and unicorns. So sometimes we have to contend with that feeling. But I do believe people are smart and intelligent and can do good things, and if they put their mind to it and think about, yep, this is great. I hope so. I'm gonna keep my fingers crossed.
Yes, I love that you mentioned the symptoms of the flu. So Jennifer, taking it back to you, your question is, I know most vaccinations have mild side effects. For example, the flu vaccine giving you flu-like symptoms. Could this be expected from the COVID vaccine as well?
We have not seen any of the research on the effects from it on those mild side effects. What we do know is typically when an individual gets the flu vaccine, they might have something mild like soreness, the redness, or they might have something like fever, fatigue, headache, muscle aches. I know we all get that kind of very heavy arm feeling after getting a vaccine. Some individuals, kind of going exactly back to what Michael was saying, some individuals might see that as an adverse event or confuse those with symptoms from getting the actual flu. They might think because they got the flu vaccine that they were infected with the flu. That's just not the case. It's just a mild reaction, mild side effect to getting the vaccine. So we might look forward to something like that. You might have the achy arm or the heavy arm feeling afterwards, but we haven't seen any research yet on this because it's just rapidly moving so quickly, and we're getting the information and processing as quickly as we can. So I know our immunizations team is looking into that, and will absolutely be studying that and following up with that in the future.
Great. So this question is for both the panelists. I'll let Michael go first, and then you can follow up, Jennifer. COVID has affected how we live, work, and socialize. Do you think things will ever return back to normal?
So I think the idea of normal is always changing, and we get used to something else, and that is now normal, right? You can talk to your parents, your grandparents about what was normal and how they don't understand TikTok now and why people are on social media as much as they are. But that is also a different type of normal. I'll be interested to see how the vaccine rolls out, how immunity, for me, quote unquote, lasts if it is like the flu, because some of what I've read is it's going to be, is it endemic? So it just comes around all the time and we always have to worry about it. If that's the case, then normal is definitely going to change, because if the process would still be to quarantine and isolate, it's going to be different. I believe that people want to get back to the way things were, like in the prompt, right? Full stadiums, being able to go to the movie theater and sit with a bunch of folks. I know people want to do that because we certainly see that professional sports is right back at it. There's no vaccine. They say they're taking precautions. They want people in the stadium. We're trying to move on as if everything is normal, yet COVID is there. So I think we're going to continue to do some things. What of that sticks around? I don't know, because I would say, like, in terms of housing and thinking about, the idea of traditional double rooms, which is a mainstay of university housing on campuses across the country, right? If we think about future proofing, and those are the conversations that we have as directors, that idea of a traditional double doesn't hold up with COVID or what's the next pandemic that comes down the road, because you live in a box that is maybe 6 feet wide. You're not going to be further than 6 feet apart. What does it look like to transition housing into more single spaces, right? To where we're creating more of that. So even the idea of a full residence hall could totally look different in the future as we think about what are the impacts of COVID in our normal work, because we certainly don't want to get back to a point of, say being full and all doubles and finding out, oh crap, something's happening now. We have to figure out what to do with half of the residential population. If you've maxed out all your housing space, you don't have options. Then what does that do to a student who needs to be on campus for classes, right? So I think normal is ultimately going to change. There will be things that happen again. There definitely will be parties. Hopefully some behaviors will be modified around it. Yeah, I think it's going to be interesting to see what that normal actually looks like and becomes, because also I think about this vaccine and how quickly actually does it roll out to everybody. If it only rolls out to the most vulnerable first, and that still takes half a year to do, we're talking about being back into a new cycle at the university with, I would say, college students in general aren't part of the more susceptible group. They will not have had the vaccine. We're probably not putting them all back in the same way that we might have in years past. I think there's unknowns.
I think you made a great point about normals. My normal and your normal, everybody's normal it looks different already. It looked different 2 years ago and a year ago before we knew anything about COVID-19. In my previous position before I jumped into public health, I traveled the world doing marketing, and normal here looked a lot different than normal when I was in China and Taiwan, in Beijing and Putian was a lot different. We wore masks every day there, and that was just normal. It wasn't something so extreme. So I think remembering that normal is relative to what's inside my bubble and what's inside my house. As somebody who I previously shared, I have a pre-existing condition, so we take things a bit more seriously. My husband and my son both work from home full time, and I think that we've transitioned quite a bit back home. We're hopeful, and we do look forward to the day that we can go and give everybody hugs. I'm not even a hugger, but I can't wait to wrap my arms around some people. And I do look forward to that. I don't know what it's going to look like in the future. And again, I wish I had that crystal ball. Do I think I'll be wearing a mask a bit longer than other individuals? I might be. I might be. Do I think that my kiddos and my husband will be, our behaviors have changed quite a bit over this past year, and I think that we'll be a bit more cautious. The flu season, we all know that that going into flu season every year, it's just kind of, I'm gonna get it or I'm not. And I think that we're being a lot more careful this year. We've all gotten vaccinated pretty early. We're even talking with our kiddo, like he was ready for it, to do anything that we can to be a little bit safer and a little bit healthier, washing our hands. Even something as simple as washing our hands. I know there have been TikToks and celebrities and different challenges, the hand washing challenge, silly things that we never thought public health would have an impact on, viral TikTok videos. But I'm thankful that at least through all of this, that we've realized how important public health is, how important vaccines are, how important hand washing is. Hand washing has become this thing that people have. Gosh, I don't even know how to explain it. Hand washing has become something so important and so powerful. And I think that those are all personal decisions we can all make. We can choose to put that mask on. We can choose to wash our hands. We can choose to stay home when we're sick. I know that I've been one of those work warriors that wants to go to work, wants to go to the office all the time, you know, and I hate getting sick. But I think that this might shift some of those decisions that we make as employers or as employees, that, hey, don't come in when you're sick. Hey, actually stay home. Hey, take care of yourself. You know, don't go out to the party or don't go out and grab coffee. If you're coughing or if you have a low grade fever, we want you to stay home. And I know it's not fun, and it's not fun to be home and sick and cuddled up, but that's really what's good for you. And it's also what's good for the individuals around you, the individuals that you might see, that you might put at risk, that you don't know have invisible illnesses or invisible diseases or disabilities that make them more vulnerable. We just don't know that. And staying home when we're sick, staying home, covering our coughs and sneezes, doing the dab to cough and sneeze, those are all behaviors that public health has preached for a very long time. Every single flu season, we're looking for a local celebrity or somebody that will really impact our community members to help motivate individuals to do that. But I think this season, specifically because of COVID-19, we're all going to take that a little bit more seriously. We're all going to wash our hands the 20 seconds, the back and the top and under the nails, all of those things. We're really hopeful from a public health perspective that does influence our new normal. If you come out of COVID and you come out of 2020 knowing how to wash your hands, like, we're doing something good. That's the little positive that we can hang on to, is if you're staying home when you're sick, or you're washing your hands and covering your cough and your sneeze, we're doing something a little bit better than we were in 2019.
I totally agree with that.
Sorry.
Oh, you can go ahead.
I was just thinking, Jennifer made a point about businesses and workplaces, and I do think there have been some changes, and hopefully those are things that are going to continue. You know, it speaks in this country, we have a really crappy setup for work-life balance and what we preach. And if you're not sick, you should be in at work. And even if you are sick, you should you feel guilt if you're not at work. And it's like, honestly, what is that about? It is better if people stay home if they're not feeling well than coming in. Like, the work will always be there. I hope for the positive, COVID helps us change workplace environment. We allow more work to occur remotely. We push the I don't feel good, great, be home. We have Zoom. If that's a thing and you still have to work and we can find you've got stuff to do, you can still Zoom into the meetings. I think technology has actually been really helpful for that. But of course, not every job carries a salary, and it is the hourly jobs do not have many safeguards, and I would hope that that gets addressed at some point too.
I definitely agree. I think we should all change our health behaviors for this new COVID pandemic. I'll send it back over to you, Ciadra.
Thank you, Ebony. This has been a great session, and I hope that you all were able to take away some great information. I know that I am so over COVID, and I'm ready to return to normal as well. But I hope that we can all just do our part so we can get rid of it as quick as possible. To wrap up this session in our program, the goal of this session and the entire program is to facilitate COVID conversations that answer questions you and I may have in a way that keeps us informed and COVID-free. Although this is our last session, it is our hope we can continue to work as a family and community to learn and share accurate information that can help us stay informed and healthy. We invite you to connect with the Health and Human Performance Department, where we share resources focused on overall healthy living, from healthy cooking monthly to show videos on adaptive workouts for every age. To our session viewers, if you have watched one of our sessions, we invite you to share your feedback via a survey that will be shared in the comments. You have the chance to be entered into a drawing to win some giveaways provided by our Student Government Association here at TAMUC. In closing, we want to thank our guest speakers for taking the time to talk and share with us, all of our panelists from the previous weeks, our instructor, Dr. Elizabeth Washira, for her guidance in planning this program, and to my group, Week 5, thank you all. And finally, to the entire HHPH 420 class that has made this program possible. If anyone can please turn on your videos to say your last goodbyes and thank yous, that would be great. All right, stay healthy, Lions.